You were wondering how you could work from home and how you were going to be able to pay your bills after losing your job. That can be tough to stay positive, and it's normal for you to be frustrated. But if you are going through a particularly dark period, ask for help. There are people out there who can help you. And if you think that a friend or a member of the family needs help, give him a quick call. Tell him that you're there to listen. We are going through a difficult time now, but we're going through this together, and help is coming.
This evening, I'll be chairing a First Minister's meeting with the premiers. We're going to talk about how to continue working together to keep people safe and supported. Over the last few weeks, in the face of an unprecedented challenge, we've seen all levels of government cooperating on a response. And going forward, that collaboration will become even more important. We will be there to support the provinces and territories with whatever they need. This includes sending personal protective equipment and other supports for the healthcare system. Last night, we received a shipment of over 1 million masks to a Hamilton warehouse. I know that people there have been working overnight to validate these supplies. This is in addition to the 10 million masks that have come in over the last days and are being distributed to the provinces and territories as quickly as possible. And this Team Canada effort goes beyond government. About 2 weeks ago, we launched Canada's plan to mobilize industry to fight COVID-19. Since then, we've spoken to almost 3,000 companies, helping us secure millions of pieces of vital equipment. And I want to share a quintessentially Canadian example of this collaboration. Our government has ordered hundreds of thousands of face shields from Bauer, the people who make hockey gear. They're creating shields to protect nurses and doctors against COVID-19. This is exactly the kind of innovative, collaborative thinking we need right now. And I know we're going to see more of it in the coming days.
Tonight, the premiers and I will talk about the coordination of our efforts and data sharing. We must work together to identify what our communities need right across the country. The provinces have made considerable progress when it comes to quickly analyzing the screening tests, which means that experts now have new data that they have to look at.
In our conversation tonight, the premiers and I will also discuss our continued coordination and sharing of data and modeling. We need to work together to know what's needed, where and when, for communities right across the country. Provinces have been making significant progress on testing backlogs, which is giving experts important data to analyze. And we're constantly getting and validating more data. That means we can share more information with you. You can go to canada.ca/coronavirus for the latest information about cases, growth, and spread. But I know a lot of people are still wondering when this will get better or how much worse it might become. You want to see the numbers and the predictions. You want to wake up in the morning and look online for the latest, more credible data you can find. You want to plan. You want to prepare for the worst. You want to know what to be hopeful about. I know. And we'll have more information, keeping coming to you with it soon. But the biggest variable in shaping these projections is you and your behavior. You must listen to the world-class doctors who are already sharing the best available information and advice. Ignoring them puts lives at risk. It's up to you to do the right thing. While many of you are staying home and limiting trips to the grocery store, too many still aren't. What the experts are telling us is that we must do everything we can today and tomorrow to set us on the right path for next week and next month. It takes time for the effects of our actions to be felt. So if we don't want our hospitals to be overwhelmed, in the coming weeks, we need to make the right choices, and we need to make them now. Our public healthcare system is strong, and our healthcare professionals are remarkable, but they're facing a threat. If every single one of us steps up right now, we can help them. If you listen to doctors, if you stay home, if you stay away from other people, we won't overwhelm our hospitals. We will protect our doctors and nurses. We will protect our friends and neighbors. It's going to take distancing and time to flatten the curve, but that's how we'll get through this. So let's save lives together by staying apart. We'll keep working around the clock to get you the help you need to do just that. Pour protéger votre emploi,
to protect your jobs, your business, or your wages, we brought in a three-point plan that will help you until things get better. Thanks to the emergency wage subsidy, we are helping your employers to keep you on the payroll. With the new guaranteed loans for all businesses, we have business owners who can now receive credit in order to come through these tough times. And with the Canada Emergency Benefit, we will be helping people until things get better if you've lost your job or your paycheck.
I want you to know that we're giving this fight everything we've got. Just yesterday, we announced the biggest economic measures in our lifetime. Governments of all orders are organizing the most significant civic mobilization since World War II. Doctors and nurses, truckers and air cargo operators are scaling up operations to levels we've never seen before in our history. But here's the truth. None of that will be enough without your help. The
idea of serving one's country changes from one generation to the next. Your grandfather may have served his country by going abroad and fighting a war. Your mother may have fought for more equality. But now it's your turn. It's your turn to contribute to the general effort. You can serve your country by staying home and following the rules. I know that that may seem simplistic, but it's the only way to come through this trial. Every single one of us has to do his part. We must all sacrifice our routine so that life will return to normal at some point. I know that we can and that we will together.
Merci beaucoup, Monsieur le Premier ministre. On va commencer par la période de questions par téléphone. Modérateur, le plancher est à vous. Merci.
Thank you. Merci. Première question, Nina Dib, La Presse canadienne. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to talk about the supply chain and PPE. We're hearing all sorts of stories about medical equipment being diverted. Have you been talking to the Americans about medical equipment intended for Canada and the need for that equipment to come to Canada? Now, I was very, very concerned when I read the report about medical equipment being diverted, and we will certainly be following up on that, and we understand the concerns of Premier Legault and others in that regard. We will be following up with Ministers Blair and Garneau to ensure that we know exactly what happened, and particularly to ensure that equipment intended for Canada comes to Canada.
I've heard reports on this issue, and of course they're concerning. We need to make sure that equipment that is destined for Canada gets to and stays in Canada, and I've asked ministers to follow up on these particular reports. We are working not just here at home, but overseas as well to ensure that the equipment that Canada has ordered makes its way to Canada.
And will you or have you raised this issue with the U.S. administration? Did you get any guarantees, or have you already received such guarantees with the U.S.? We are working with the Americans, and we are following up on that specific issue. We're working together, and we understand that the needs in the U.S. are very extensive, but it's the same in Canada, so we have to work together to ensure that we can control the spread of this virus. So we're working with the U.S. and we will continue to work with the U.S. to ensure that we have the equipment that we need.
Prochaine question.
Thank you. Merci. The next question, Alex Ballingal, Toronto Star, line open.
Morning, Prime Minister. You mentioned getting more information on the numbers and predictions soon. What does soon mean, and what information specifically are you referring to?
I think, first of all, we can highlight that there has been tremendous transparency on the raw data, on the numbers of cases, on where they are, and we're, of course, adding to and collaborating closely with the provinces on making sure that those numbers get out there. The question of analysis of those numbers is the next question. People want to know what the model is, how long they're likely to be in this situation, when kids can see their friends again, when we're going to be through this phase and get back to work. Those analyses depend directly on Canadians' behaviors. They depend on whether or not people follow the rules around social distancing, around staying 2 meters apart, around isolation, about not going out for groceries more than once a week if you can. These kinds of things will have a direct impact on which of the various models that are out there will be the one we take. And we're going to continue to work on those analyses. We're going to continue to crunch the data and numbers, and we're going to continue to be open with Canadians about those expectations. Okay.
I understand that people want more information. They want to know how long we're going to be in this situation, when they're going to be able to get back to their jobs, and when they're going to be able to see their friends, particularly the young people out there. But we are sharing the data, in other words, the number of cases there are, where the cases are each day, so that people can know what's happening. But they're also interested in the analysis of that data and the modeling that may let us know how long this could last. Now, obviously, those models depend directly on the behavior of Canadian citizens today, yesterday, and tomorrow. That's why it's so important that every single one of us does what is necessary, follows the rules, stays home, keeps a safe distance, and minimizes their contact with anyone else, so that we can succeed in coming through this.
Just as a follow-up, you yourself a couple days ago described some of the scenarios as fairly dire. Why is it that you can't release the projections that you have now, the range of scenarios that you've talked about, from things working to things being fairly dire?
I think people can imagine a range of scenarios that shows everything from everyone gets suddenly better within the next few weeks to this situation just keeps getting worse, and we face a situation like some other countries in the most dire situations have. There is a range out there, and just highlighting that range is not as useful or important as being able to get clearer numbers and clearer analysis of what we are likely to face. But everything that we are going to face will be directly linked to how people behave today. And that is why it is so important that people stay home, that they continue with the social distancing, continue keeping 2 meters apart, continue to look to minimize their movements as much as possible so that we can get through this in the best shape possible. Okay.
I understand that people may imagine all the different scenarios that could be from not too serious to very, very serious, as we've seen in other countries. But the important thing for us is to be able to provide realistic modeling, and that depends directly on the behavior of Canadians today. Whether they continue to self-isolate, whether they maintain the proper distance from others, and their behavior in general these days. All of that will have an impact on what we see in future.
Thank you. Merci. Prochaine question, Raymond Fillon, TVA. À vous.
Good morning, Prime Minister. Just along the same lines, those modeling scenarios, is it because you're concerned that data will cause a lot of anguish and panic? Because a lot of people want to know where we are at. And in other countries, such as the United States, they are providing that information to citizens. Well, I do think it's important for people to get information so that they can know what to expect. But at the same time, the important thing is for people to know that their choices and their behavior now have a direct impact on any model that we may end up seeing and what happens in the next few weeks of self-isolation. As I said, we're going to be in this position for several weeks and perhaps several months. But we need to send a clear message to Canadians, and in order to give clear information to Canadians, we need to analyze the data. And the fact is that we are sharing data. There are models out there that people are looking at, and there will be more to come in the days and weeks to come. Your health minister said that the healthcare system is not in a position to deal with a huge surge. Now, why is it there wasn't enough PPE in the national stockpile? Well, I think that many governments around the world are going to be reflecting on that very issue once we come through this. And we will certainly learn a great deal from this experience and this crisis. For us, the essential thing right now is to ensure that we are able to deliver the necessary equipment to the healthcare system, that we try and flatten that curve as much as possible so that we will not end up in a situation where our hospitals and our healthcare system are overwhelmed and we no longer are able to care for people who are seriously affected by COVID-19. And that's why everything we're doing right now is aimed at protecting people.
Dernière question, modérateur.
Thank you. Merci. Next question, Mia Ratson, the Canadian Press. Line open.
Good morning. I'm wondering if you could explain to us, if you're not going to tell us what those analyses say yet, can you tell us what metrics are going into those analyses? What are the key things that you're asking to be told about that is guiding your decision-making right now?
What we've been working with the provinces on is ensuring that we have the best possible data. We've seen over the past days there's been a lot of clearing of the backlog in testing in a number of different places that is giving us more accurate images on how COVID-19 is spreading, on where it's spreading, on how it's being transmitted, and on how the measures that we're bringing into place are working. I'll be speaking tonight with the premiers about this data, about the modeling and analysis that's going on, and we look forward to being able to share more information soon.
Good morning, Prime Minister.
Go ahead, Mia.
I'm also wondering if you're talking about Canadians not staying home, that some are, but there are still too many that are not. Does Canada have the ability, and would you consider using that ability to issue a national mandatory stay-at-home order?
That would be part of the Emergency Measures Act that could be brought in. At this point, we've been working very closely with the provinces who themselves have more measures that they have the ability to put in. We've seen certain provinces bringing in more and more stiff measures. We will continue to work with them, and the Federal Emergency Measures Act really becomes necessary once provinces have exhausted all their significant powers under the Emergencies Act, and we're not quite yet at that point.
Good morning, Prime Minister. Olivia Stefanovich, CBC News. Other countries have been able to release detailed modeling. For example, New Zealand is projecting a 65% infection rate for its population, a 1% fatality rate, and also a 20% fatality rate for its elderly Maori people. So I'm wondering why your government can't release the modeling you have in your possession right now to help Canadians prepare and to also make sure that Canadians keep following the rules. What's stopping you from releasing this information right now?
One of the things that we'll be talking about tonight with the premiers is how to make sure that all our various sources of data are aligned so that we can get more accurate models. How we make sure that the analysis that we apply to the data that's coming in, that's being published daily so Canadians can see it, actually makes sense and reflects what's going to happen in Canada, what's going to happen in various regions across the country, which will be different from what happens in other countries around the world. That is sophisticated modeling work that's being worked on right now, that is ongoing, and we look forward to sharing more with Canadians in the coming days.
What are your government's plans for returning cruise ship passengers from Florida? How will they get home? Will they be quarantined or allowed to self-isolate at home?
Anyone who returns from overseas needs to be quarantined for 14 days, needs to be isolated so that they do not spread COVID-19 in the population. We've received many, many Canadians who've returned home over the past couple of weeks. There's still a few more to come, but far less than have already come, and those people have been isolating. We've been asking people to make sure that they don't stop into the grocery store on the way home from the airport, that they go straight home, that they isolate, that they understand they pose a real risk, not just to their neighbors and their loved ones, but to our entire country. We need to ensure, and we will ensure, that those people are properly isolated.
Respectfully, the question was about these passengers specifically from Florida. How are they going to be getting home, and will they be quarantined somewhere specifically or just asked to go home?
My understanding is they will be flown home on a charter flight, but we're still looking for those details, and we will ensure that they are isolated when they get home. Okay.
We understand that there is a charter flight that will be bringing them back to Canada, and of course, they will be isolated when they return.
Minister Janet Silver, Global News. Just to go back on the modeling numbers, the data, why not release the numbers now if we're really trying to get Canadians to understand the difference that their behavior makes? Given the warm weather, given people want to go outside, why not release the numbers now so that they really understand just how much of an impact their behavior will make?
We have been releasing numbers. We've been releasing the data regularly. We're improving the quality of the data. We're coordinating with the provinces to make sure that the data is consistent right across the country. And that is the numbers that we are putting through into various models. And as we get those models more accurate, we look forward to sharing them with Canadians.
Just to switch gears now on China, U.S. intelligence reports reveal that China concealed the degree and the severity of the outbreak. I'm just wondering, does Canada have the similar intelligence? And in the past, we have said that we trust China and their information. Do we still trust China and their information?
We know that countries around the world have been sharing information with each other on their cases and on what has been effective in terms of measures. We've learned a lot from South Korea, Singapore, and other countries. We've learned, unfortunately, a lot from Italy as well in terms of what worked and what didn't work there. We need to keep learning from other countries, but we also need to be really thoughtful about how we process and understand that information. Obviously, there'll be many questions as this is all worked through over the coming months and indeed years on how this was handled, what lessons are taken, who did well, who didn't do as well, and who was perhaps not as forthcoming with the global community as they should have been. Those are questions, though, for future times. Our focus right now is on getting through this in a way that keeps Canadians whole and safe. Okay.
We recognize that there is a great deal of information out there about what various countries have done, and we can learn from what has worked or not worked around the globe. But in the months and years to come, there will be a great deal of reflection and analysis as to what country did this, how did they manage the crisis, and whether there are countries that were not honest with the rest of the world. Certainly, it will be important important to know that, but for right now, our priority and our emphasis is on how we can do things and what we can do to protect Canadians.
Thomas, CTV National News. The Canadian Centre for Policy Alternatives released new numbers today that said over 800,000 Canadians will get no income support during this time. These are people that were unemployed or looking for work before the crisis. Of course, they don't qualify for EI. They're not going to get that emergency benefit. Are you looking at anything to help these people?
Yes, absolutely. We're looking at ways to help everyone in Canada that needs it. The two measures we put forward, the wage subsidy through employers and the Canada Emergency Response Benefit, will help millions of Canadians, but we know that there are many vulnerable people who won't be able to access this support, who will need extra help. We're making sure that we're flowing funds through shelters, through nonprofits and charitable organizations as well, but there will always be more to do to make sure that everyone, particularly our most vulnerable, are able to keep themselves safe and keep our communities safe by being able to do the right things and have the support.
We recognize that even with the unprecedented measures we've introduced, with the Canada Emergency Response Benefit and help for employers and employees, there are people who will not qualify, and therefore we're going to continue to work particularly to help the most vulnerable Canadians who need support during this difficult time in order to protect themselves and protect the community. So that's why we will continue to reflect and see what we can do to help people so that we can come through this together.
Atlantic Canada provinces have blocked entry of people from outside their provinces to keep people safe. Of course, Quebec now has police checkpoints along the Ontario border. If you enacted the Emergency Act, obviously this could all be uniform in line across the country. So should we be locking down each province in lieu of that?
I think every province is going to look at what its own needs are. The Northern Territories, for example, brought in very strong measures much earlier on than anyone else because they recognized the extreme vulnerability of remote northern populations to an infectious disease like this one. Every different province is looking at what measures it needs to take, and the federal government will provide the support to all provinces that need our support as we move forward. Yes, there is a Federal Emergencies Act that we can bring in, but as I said, the moment to bring that in is really when there are things that the provinces and Canadians need to see done that can't be done by the provinces. And we will continue to work very, very closely with the provinces and all jurisdictions to ensure that the tools that everyone has at different levels are used as they need to be.
Bonjour, Monsieur Trudeau. Louis Blouin, Radio-Canada.
Radio-Canada. Good morning, Mr. Trudeau. As certain medical equipment becomes more difficult to secure, are you concerned that the provinces will become more protective of their own PPE and perhaps not as inclined to share? Is that part of your concerns, and will you be discussing this with the premiers? We want to ensure that once we come through this time where there may not be enough equipment available, that we're in a place where Canadian production is sufficient for the entire country, and even once we have enough for ourselves, to be able to share that equipment with other countries that need it. This is something we're working towards now. In the meantime, we can ensure that all the regions receive all the equipment they need. We know that needs are different from one region to another, and that's why we're coordinating all of this with the provinces. Mr. Trudeau, you seem to be have a bit of a scratchy throat today. So are you still okay? Are you still healthy? Oh yes, I'm very healthy. You know, I spend an hour with you every single morning, and perhaps maybe I should wear a scarf. But no, I'm absolutely fine, and thank you for asking about it.
Yes, you noticed I may have cleared my throat a couple of times today. There is absolutely nothing to worry about. I have no symptoms of COVID. It perhaps means that I should get back to wearing my scarf, even though it's nice and sunny out this morning. But thank you all for your concern. I'm doing just fine.
Merci, c'est ce qu'il mieux fait à la conférence de presse d'aujourd'hui. Bonne journée.
Merci tout le monde.
All right, that's the Prime Minister of Canada, experiencing the same thing we all do these days. If you cough, everyone turns and looks at you and wonders if you're...
Or pulse.